Christmas, Massachusetts was reporting roughly 80,000 active COVID-19 cases in the state. Now, that number is more than 92,000. So here to talk it through with us is Dr. Sharon Wright, Senior Medical Director of Infection Control and Hospital Epidemiology at Beth Israel Deaconess Medical Center. Good to see you.
Good to see you too.
So when we talk about these 92,000 cases, do you think we're seeing a surge from the holidays, or is this something else happening?
Probably a little bit of a combination. We did definitely see a surge after Christmas with people traveling and spending more time with people outside of their households, probably than we all should have been doing. And so it's getting a little bit far from Christmas now for us to be seeing the full effect of that alone. And there's a question as to whether we're seeing a little bit of the effect from New Year's, still a little bit soon for that, or just as the weather gets colder and everyone moves inside, that we are all getting exposed as we try to socialize with people, even when we think we're doing it safely.
So when we talk about the impact of that, the 7-day average for new cases now above 6,000 a day, what does that mean in terms of the pressure on the healthcare system? And what are you seeing right now in terms of hospitalizations and deaths?
I think it depends on how long it keeps up. Right now, the hospitals seem to be in a little bit of a better spot than maybe a week ago, but they're still incredibly busy and full. We do have the DCU Center and up in Lowell to help with some of that surge of patients, but it's really staffing because, hospitals haven't stopped all the regular business that patients need to keep them healthy. And so even though we cut back some, it still gets quite crowded in hospitals. If this continues and continues to grow, then we could potentially develop a problem.
We're seeing a lot of these new infections involve younger patients, and it made us wonder if the state should consider pivoting and vaccinating people in their 20s and 30s now, and if that might effectively slow the spread. What do you think?
So in the end, we really want everyone to get vaccinated. That's how we're going to get out of the position that we're in with the pandemic. But remember that what the vaccine really does, and the goal of the vaccination program, at least in the early stages, is really to prevent the severe illness and complications of COVID-19, to reduce hospitalizations and impact that surge that you're talking about, and reduce deaths. And all of those things are still seen more in older patients, especially those over 65.
Yeah, that's a good point. All right, Dr. Wright, thanks for your time, for your insight. We really appreciate it.
Thanks for having me.